The Allander surgery in Springburn in Glasgow is one of the deep end practices in Glasgow dealing with one of the poorer, more deprived communities, and we are looking at the role of the link worker in the deep end practice, and we're getting extremely good feedback from patients, from the link workers and from the GPs that this is absolutely the right thing to do to improve the provision of health and well-being services in the more deprived parts of Glasgow and indeed Scotland. Initially the project was to run for 2 years. We've extended it to 5 years, and once we get the interim evaluation we'll then look at extending it right through all the deep end practices in the country. At the moment there are about 7 deep end practices involved in the project, and if it is shown to work, which clearly the early signs are very, very positive, then our ambition would be to roll it out to all the deep end practices, and there's over 100 of them in Scotland.
So the Links Worker Programme is currently operating in 7 practices in Glasgow, and that includes 5 neighbourhoods ranging from Drumchapel, which serves the 47th most deprived area in Scotland, through to Easterhouse, which serves the 4th most deprived area in Scotland. And then there's 5 neighbourhoods in total.
That's one of the bits of the job that I really enjoy, is to see the difference that the programme makes to people's lives. From people who, when I first met with them, spent half an hour crying, talking about the situation in the consultation room, and then, a couple of weeks later to tell me about, some of the community activities that they've engaged in and how much better and more confident they feel, and, feeling positive about the future.
It's absolutely essential to it, because very clearly the people who are in Springburn and Postle Park and these poorer parts of Glasgow are the very people we need to help to get a better quality of life and a better standard of living. Now, the health service can't do that on its own, obviously. GPs can't do that on its own. It has to be part and parcel of a wider strategy, which it is, but the health service and GPs in particular, and now link workers as part of the GP team, can play a really important role in improving the health and well-being of people who are living near or below the breadline.